Dr. Zhu, a chief physician and associate professor, obtained his master's degree from Tianjin Medical University in 2012 and his doctor of philosophy from Heidelberg University in Germany in 2017. He has been working in the Department of Ultrasound Medicine at Datong Fifth People's Hospital for nearly 10 years, accumulating extensive clinical experience. Dr. Zhu specializes in the ultrasound diagnosis of abdominal, small organ, thyroid, breast, scrotum, lymph nodes, etc., and vascular diseases. He has significant expertise in interventional ultrasound. His primary research focus is on the clinical application of three-dimensional echocardiography in cardiovascular surgery and interventional treatment of structural heart diseases. Dr. Zhu has published over 10 professional papers and has consistently received the Excellent Worker Award for several years, earning high praise from patients.
Hello, Dr. Zhu. My name is Sun Ying. He's my team member, Zhao Duan. Nice to meet you.
Hello, nice to meet you. I'm happy to join this interview.
Okay, thank you. I'm very glad you could take the time to participate in our interview. If you feel that our question is not convenient to answer, you can pass it. That's okay. I heard that you have been involved in this work for more than 10 years. So what basic professional skill do you think you need to have in this profession?
Okay, I think first and foremost, a solid understanding of anatomy is crucial. You need to be very familiar with the various structures of human body, knowing the normal shapes and locations of each organ and system. This knowledge is essential because you need to accurately identify these structures in images and distinguish between what is normal and what is abnormal. Secondly, you need a good grasp of pathology. In addition to knowing normal anatomy, you should understand how different disease affects the structures. Many diseases cause specific changes in body and can be in images, such as tumors, bleeding, or inflammation. Recognizing these imaging features helps you make accurate diagnosis. The third important skill is imaging technology efficiency. This includes understanding the principles and the use of various imaging techniques like X-rays, CT scans, MRI, and ultrasound. Each technology has its strengths and limitations, and knowing when to use which one to get the best results is key. That's all.
Okay, thank you for your answer, Dr. Zhou. So we know that in reality, sometimes our professional skill cannot support us to solve all kinds of questions. So next question I want to ask is, what kind of soft skills should someone in your professional have?
Oh, that's a great question. In addition to the technical skills, several soft skills are essential for someone in the diagnostic imaging profession. These skills help you interact effectively with patients, colleagues, and other healthcare professionals. Here are the key soft skills you should develop. The first one is communication skill. Effective communication skill is critical. You need to be able to explain complex medical information in a way that is easy for patients and their families to understand. Clear communication with other healthcare professionals is also important to ensure accurate and efficient patient care. The second one is teamwork and collaboration. Diagnostic imaging professionals often work as part of a large healthcare team. Being able to collaborate effectively with doctors, nurses, and other healthcare providers ensures that patients receive comprehensive care. And the third one, emotional resilience. Working in healthcare can be stressful, especially when dealing with serious or life-threatening conditions. Having emotional resilience helps you cope with the stress and continue to provide high-quality care.
All right. We all know that career development has been moving at a very rapid pace in recent years. So how do you see career in terms of professional development?
Okay, I think the lifelong learning is an important pathway, and this includes several aspects. Firstly, attending continuing education courses and workshops provides hands-on experience with the latest technologies and methodologies, and the most up-to-date knowledge can be learned through online courses. Secondly, joining the professional organizations like the Radiological Society of North America or the American College of Radiology, and attending meetings allows you to network and gain access to the most valuable information. Additionally, I develop a consistent literature reading habit and frequently browse PubMed for the latest research findings, which will help you understand where the current developments are and contribute on top of it.
Okay, thank you, doctor. So the next question I want to ask is, well, the fresh blood in the field is important to drive the industry forward. Somehow amateurs are regularly have difficulty when they join their job first time. So may I ask, what are some of the skills that are lacking in today's young graduates?
Okay, of course, nowadays, many young graduates tend to focus too much on theoretical exams and neglect the importance of practice. At present, I understand that a lot of university education has also paid attention to this point and included some hospital placement in the curriculum. Which is very helpful. In addition, the ability to adapt to change is another area where young graduates need to improve. There are many unexpected situations in clinical practice that require us to make accurate judgment quickly, which of course requires a wealth of clinical experience. But there is no doubt that this is exactly what fresh graduates lack most. Similarly, skills such as time management, interpersonal skills, and motivation are essential for adapting to the challenging work environment, remaining competitive, and achieving long-term career success.
Oh, yes. In the busy work, we cannot help but feel stress and tension. So do you relieve it? How do you relieve it?
Oh, okay, I understand your question. Managing stress and anxiety at work involves several key strategies. First, effective time management is essential. For example, breaking down the large projects into smaller tasks with achievable deadlines can reduce feelings of overwhelm. Second, the maintaining proficiency is relevant in relevant skills is crucial to confidence and efficiency. Keeping your skills strong is fundamental to your ability to manage anxiety with ease. And finally, taking regular breaks throughout the day, such as short exercise or short breaks, helps to refresh and maintain focus. Remember that anxiety is everywhere and don't be afraid of it, but gradually recognize it.
Okay, thank you, Doctor. So my next question is, along with the development and progress of the society, the situation in this field is changing rapidly. So could you please tell me the exceptions and challenges professionals face in the current local or global climate?
Okay. Now, today's professionals face a wide range of expectations and challenges, both locally and globally. In different regions, we may be faced with different diagnostic equipment, as well as different prevalent disease, which may be different from what we have learned in books, requiring us to adapt to the specific situation in order to remain competitive. On a global scale, professionals need to remain sensitive to the overall global needs at all times. For example, in response to the global epidemic of COVID-19, professionals need to quickly anticipate possible diagnostic criteria for the COVID-19 and quickly develop the criteria for other clinicians to guide them through the validation of large sample sizes. The ability to innovate, collaborate across borders, and maintain ethical standards in today's complex global climate is also critical. In short, professional needs to balance the need for local specialists.
Oh, okay. Thank you, Doctor. So do you have any insight and advice for aspiring professionals in this field?
Yes, of course. Aspiring professionals in diagnostic imaging should prioritize continuous learning to stay updated with technological advancement and medical practice. This commitment ensures they remain competitive and proficient in their field. Moreover, aspiring professionals should seek mentorship to gain valuable guidance and insights from the experienced professionals. Mentorship can accelerate their learning and provide direction in navigating challenges and opportunities in their careers. Additionally, networking with peers and joining professional organizations facilitates the knowledge sharing, fostering collaborations and open doors to career growth and development. However, you should be reminded that despite the current enthusiasm for academic pursuits, in many places, as a healthcare worker, we must focus on practice, and providing good service to our patients is our top priority.
Okay, thank you, Doctor. And so, as we all know, no one is good at something naturally, and we have difficult period of time. So would you like to share the biggest confusion you have encountered with?
Well, there are a lot of confusions at work, and I think the most confusing one is the choice of career path. In my work environment, it's difficult to support the further development by purely clinical work, and often you have to make some trade-offs between the clinical and the scientific research and even socializing. But this degree is difficult to grasp. I think this is a confusion you need to face in the future too. But unfortunately, I don't have a good solution yet. But I can only suggest that you take this into consideration in advance.
Okay, thank you, Doctor. So these are all of our questions. Thank you for taking time out of your busy schedule to answer us today. It was great experience to hear your answers, and we are sure that your answer will not only help us, but also will help many new people who are starting out in this field. Thank you again for taking the time to answer our question, and we wish you the best of luck and good health in your work. Thank you.
Thank you.
Yes, thank you. Have a nice day.